This is what I've learned in the first couple months of taking testosterone replacement therapy. Most guys will start taking testosterone replacement therapy, or TRT for short, because they have low testosterone. Prior to starting TRT, my free testosterone was 534, which is pretty decent for a guy at 51 years old. As Jason, my stem cell guy in Florida, said, do you want to be okay for your age, or do you want to feel good? Which is a great point. In that same discussion I had with him, and this has been a couple of years ago, he also showed me an article that said that TRT had been shown to improve ejection fraction, or at least slow down the degradation of it in heart failure patients like myself. Since my heart is failing faster and faster, and I'm highly anemic on top of it, I revisited this discussion with Jason a couple months ago, talking again about the possibility of TRT. Again, most guys are simply using TRT to increase their testosterone levels. My situation is a lot more complex than that. Some of the pros from TRT in my situation are, one, that I just mentioned a little bit ago, is that it could help slow down the degradation of the ejection fraction, which means I'm slowing down the heart failure process of the actual muscle tissue of the heart. A couple other benefits of it is that it increases red blood cells and energy levels. For me, being highly anemic right now, those are both good things because they may sort of bridge the gap while I'm trying to get this anemia fixed with iron infusions. And who wouldn't like to have the libido of an 18-year-old, or at least an 18-year-old in the 90s, maybe not a modern day 18-year-old. The downsides, and there are several, one is that as soon as you start taking TRT, you're pretty much stuck on it for life. Because as your body gets flooded with the TRT, the body's natural production of testosterone is going to diminish, and it'll stop producing it because it doesn't see a need when your testosterone levels are already high enough. Testosterone can also enlarge the heart, and my heart is already severely dilated. So although there are some downsides, because I'm terminal, I'm really not too worried about long-term effects like that. I began on 0.25 milliliters of 200 milligrams per milliliter testosterone enanthate twice per week. So that means 0.5 milliliters of the TRT solution per week. A buddy of mine started taking it around 6-7 years ago, and at that time he would take it once per week, and then it kind of tapers off, and then he takes it again. Now he's actually up to taking it 3 times a week. So he'll take it once, it drops, take it again, and then it drops, take it again, and it drops. And the reason that you take it more times instead of just once is because each of the solutions you're taking, they have different properties and they break down at different speeds in the body. But what you really want to do is have a consistent level of testosterone in the body. So if you're only taking it once a week and you spike it way up here and then it goes way down, then you're more subject to some of the potential side effects, and it's just not as good as your body maintaining a nice even level. Every time you inject, you're creating a little bit of scar tissue at that injection point. So we want to vary the injection points as much as we can. Some guys might just do alternate between the shoulders back and forth. A lot of guys will actually do alternate shoulders and glutes. So you might have 1, 2, 3, 4 points. The more different places you have, the less scar tissue you're going to build up in any one of those places. For shoulders, from what I researched, nobody shoots in the front. The location that they recommend is like 3 finger lengths down from the bone prominence right up here. Now, the more you can vary it, like a lot of guys will do kind of side to the rear, but even when you're shooting into that spot, even though you're varying across the body, even within that spot, you want to vary it around that area as much as you can, not just like, don't pick a mole or a point on a tattoo and just keep shooting that same spot every time, or you're going to build up scar tissue in that spot, and it'll make it harder to inject over time. For injecting into the glutes, you also want to try to avoid the sciatic nerve, which is a little bit lower, and so they recommend a little bit higher on the glute. That also probably is because there's more fat potentially as you go down the glute, but higher up there you should be getting into the meat. To inject, you're of course going to need some needles and syringes. Mine actually came as an assembly from the supplier of the testosterone, and I have 3 milliliter syringes. They're a 25 gauge needle, 1 inch long. So those are kind of the 3 specs that you want to look at when you're choosing your syringe and needle. Mine also have a post-use protector, plastic piece that comes around to shield that needle to protect sanitation workers down the line. If you don't have those on it, even if you do, it's a good idea to have a sharps container and throw your used needles in there. From what I can tell, 1 inch seems to be a good length of the needle. It gives you enough length to get down into the tissue. Obviously, if you have a lot of fat on your body, you may need a longer needle to get through the fat and into the muscle. But you also don't want to go too deep either. For the enanthate and probably anything that's oil-based, 25 gauge is small, and it's going to take a while to draw that fluid out of the vial. That's just a reality. Oil is thicker than water, and it's going to take time. However, you want to have as small a needle as you can get by with, because that's going to leave a minimal hole, minimal scar tissue when you inject. Also, it leaves a minimal hole, so you reduce the chance that some of that testosterone is going to bubble back out when the tissue starts squeezing together again. So 25 gauge is what I've been using. Yeah, it takes a little bit of patience to get it out of the vial, but again, it's a small enough one that it's pretty easy to inject and not doing a lot of damage. Like I said, I'm only doing 0.25 milliliter doses right now, and I have a 3 milliliter syringe. So if you think about it, you got this big syringe, and it's got 1, 2, 3. It's really not that big. 3, 2, 1, and 0, right? And then you've got your needle here, and you've got your plunger out back. So I'm only doing this much right there, and I do have to kind of get it eyed between marks. So I have a mark for 0, I have a mark for 1, for 2, and then I'm trying to Calvert eye that 0.25. If I had a 1 milliliter syringe, it would be much easier to measure it, because I would then be getting, you know, like if this were a 1 and this was 0.5, 0.25 would be here. So it would be easier to get more accuracy in how much fluid I'm drawing in. The advantage, however, of a 3 milliliter is that when you're trying to draw the fluid in, you can pull this plunger back all that way, and it makes more of a vacuum in the syringe to help pull that fluid in out of the vial. So there's pros and cons. I'm using the 3 milliliter syringes right now because it's what came with the fluid. Once those are gone, I may try a 2 milliliter one, see how that works. Maybe it gives me a little bit more accuracy and still has enough vacuum to pull with. And as I mentioned earlier, I am using an assembly of this, but you can buy the syringe and needles separately. So if you really know what you're looking for and you can't find it as an assembly, look for it in individual pieces and put it together yourself. In order to actually inject the fluid, first identify your location, whether it's on the shoulder or the glute this time. Find the spot and wipe it clean with alcohol. While you're letting that dry, don't lay the exposed needle on a dirty sink or anything like that. Make sure that stays clean as well. The next thing to do is take the vial, and on the top of it, you'll see this little rib. It's gonna have kind of a rubber cap on it, and you're gonna stick your needle somewhere in the middle of that. Then you're gonna tip the vial on its head, and you're gonna stick the needle into the bottle. You're gonna have the syringe out here and the plunger and all that. The trick with this is that the fluid has to be above the level of the needle. So if, let's say, your needle is out here, you may have to do that if you've only got this much fluid. So the less fluid you have in the vial, the harder it is to get that needle right into that fluid. If you have it above the fluid line and then you draw back the plunger, all you're gonna do is suck air. You wanna be sucking fluid. So you're gonna hold it still with one hand on the vial, and with your other hand, you're gonna put the needle in there and you're gonna pull back this plunger and you're gonna hold it back, and that's gonna create vacuum here, and that vacuum will slowly pull the fluid down the needle and into the syringe. You'll wanna get more fluid than the dose because you're gonna end up with some air in it. Once you get past the level, a healthy amount, and this is gonna take some practice, then you're gonna end up pushing back a little bit, and you want whatever air is up here to be gone. You want all that air up here so that you're purely fluid. So if your dose is 0.25, you want it right there, and you want all the fluid from there all the way up. Then you're gonna remove the syringe and needle from the vial, set the vial down, and slowly stick the needle into the injection point all the way in, so the full 1 inch is in the muscle tissue. If you feel a nerve at any point, pull it back. Now the next thing you're gonna wanna do is aspirate it. So that basically means that you're gonna stick the needle in, you're gonna try to sort of pull this plunger back a little bit, and when you pull that plunger, if you see blood come into the syringe, then you know that you're punctured a vein and you wanna find a new spot. So pull the needle out, go someplace over. Once you have a good spot, go ahead and depress the plunger the whole way. Make sure you've got all the fluid in there that you can out of the syringe, and then slowly withdraw the needle and discard of it properly. Now this was a lesson that I learned after my first vial. So I had vial 1, 5 milliliters in it. So let's say here's my first vial at 5 milliliters, and at 0.25 milliliters or 0.5 milliliters per week, that should have lasted me 10 weeks, right? Or 20 doses. What it actually lasted me was 15 doses. Now this is a controlled substance, and so people get very touchy about how much you're using and making sure the numbers match with what you're being prescribed and how much you're being supplied. So you have to be careful about this, and here's the thing that wasn't obvious to me at first, and I kind of had to learn the hard way. The reason I was running out early is because in the syringe, as I mentioned, you have a 0 mark, and then you have your line. So let's say I was here at 0.25, I had that much fluid, and then I depressed the plunger and I used the 0.25 fluid to 0. There's still fluid here in the bottom of the syringe and in the needle. And you wouldn't think it'd be that much, but when you're only using 0.25 milliliters out of a 3 milliliter syringe, there is going to be waste here. So it's not like you're overdosing, you're still just only getting the 0.25 milliliters, but you are using it faster out of that bottle. So what I found is, do the math, I was actually using, instead of 0.25, I was using 0.33 each time out of the vial. That's why it only lasted 15 doses instead of 20. So what you need to do is make sure you talk to your clinician and say, hey, I know there's going to be some waste out here. How do we account for that? What I found is that 0.08 milliliters was being wasted each time I'd take a dose. I'm just telling you to make sure to have this discussion with the doctor and address, how do I handle the waste to make sure that my bottles are lasting as long as you're prescribing it? Because especially when you're talking about tiny doses here, that can make a big difference. The next thing that you're going to be doing is getting lab work done. My clinician said they wanted to see lab work about every month or so, just to make sure that we are, for one, seeing how the testosterone is doing. Is it going up? Is it not going up? Is it too high and we need to back off? Usually they're going to start lower and they're going to increase it just because they don't want to get too high with it. The other things they're going to look for are things like red blood cell count. Is that getting too high? Obviously with anemia, that's not a concern here. They're going to look at things like liver and kidneys and other items just to make sure that you're not having any kind of negative effects from the TRT. They're also probably going to look at estrogen. So when your body has testosterone, which normally does, some portion of the testosterone is going to get converted into estrogen. I'm currently taking an anastrozole, which is an estrogen blocker. And by taking that, it sort of lowers how much estrogen might be produced depending on how much testosterone is in my system. Some doctors will want that because they don't want you to get side effects that might come with too much estrogen in us as males. Others actually might prefer that you not take an estrogen blocker and you let the body regulate its ratios properly. So this is again something you want to talk to your doctor for your specific case and see if they want you on estrogen blockers or not. And they may need to do one lab cycle or two before they make that decision. I've only been taking the TRT for about 2 months or so. I just had labs done a few weeks ago. My labs were not significantly higher than what I was before. Again, I'm taking a fairly small dose, so that may be part of it. It may be that my body is, again, my body was producing reasonable levels of TRT before, so my body may just be slowing down on its natural production as this other stuff is coming up. So even though my free test is about the same, it may be more the synthetic than the natural now that I've been on it for a couple months. So I would expect that my clinician is going to raise the amounts that I start taking, raise my doses, and then again, if the doses do go up, I need to make sure to address, hey, I'm gonna need more of a supply. Let's make sure all the math works out so that I'm getting what I need for a supply to meet the doses I need and consider this waste as part of that process. Another buddy had started at around 250 when he started TRT. He noticed some pretty drastic changes in the first, couple weeks, he said, or so. Mood, libido, noticed he was sleeping better. He was, again, doing it once a week at that time. So he was taking a heavier dose right off the bat, and so it had more time to dip down and then come back up on his next injection. But again, because he was going from a natural 250 all the way up to, whatever 600, whatever he was at with the TRT, it was a pretty drastic change for him. Again, since my levels have not actually changed that much, I personally haven't felt a whole lot of difference from this. Now that I would expect they're going to raise it, that may change. I may notice a little bit more difference, I guess. But again, my main purpose for this is trying to augment the issues I have with anemia and maybe bridge the gap for things like red blood cell and the lack of energy that the anemia is causing. So I have a little bit different purpose, but just starting out and just wanted to provide a few tips for beginners on TRT. If you got any other comments or tips or questions, please put them in the comments below. If you haven't subscribed to the channel, please do so. Click the link, hit the little bell for notifications, and let's live for today.